So our first speaker is Dr. Jiao Xie. So she will be speaking on antifungal therapeutic drug monitoring and dosing optimization in Xi'an, China. Jiao is a pharmacist researcher who seeks to advance the use of TDM and individualized dosing of antimicrobials. Her doctoral thesis focused on PKPD optimized tetracycline dosing in critically ill patients. She leads projects funded by the NSFC, or Natural Science Foundation of China, for the Shanxi Provincial Natural Science Foundation and the Shanxi province. She has published more than 50 papers, and I have had the pleasure of spending some time with Jiao here at UQCCR for 1 year.
Hello, everyone, and it's really honored to share my topic with antifungal therapeutic drug monitoring and dosing optimization from Xi'an. It's really honored to be invited by Jason and Hafiz and to allow me to I think this topic today is will allow us to get to know each other and offer some probability for future collaborations. At first, just please allow me to give a brief introduction about the background of our hospital. So the second affiliated hospital of Xi'an University is one of China's 44 university affiliated hospital under the administration of education at the National Health Commission. And also we have more than like 2,500 beds already. And our hospital has more than 3,000 staff members, including over 400 senior medical professions. Each year, we receive more than 2 million outpatient and emergency visits and over 80,000 inpatients admissions. Our hospital has 48 clinical departments and 6 centers, as you can see, including the dermatology center and children's center, oncology center, cardiovascular center, and brain center. We have 4 CAPAs and 20 national key clinical specialties project and 4 national major disease MDT programs, a national clinical skill training base, and a national residence training base. And here, as I am a part of hospital's pharmacy department, we have 9 medication dispensing rooms. We are a national clinical pharmacist training base and a member of antimicrobial drug monitoring network. We are a sentinel hospital for ADR monitoring and a national drug abuse surveillance sentinel hospital. We also have a traditional Chinese decoction room and a clinical pharmacy training base. We're now having more than 100 pharmacy staffs. So here, because I am a hematology clinical pharmacist, so I'd like to show you about what we are like doing our daily works. So here is a focus our clinical pharmacy with, as you can see, our consult continues rising each year, including the infectious disease and anticoagulation pan pediatric in recent 5 years, including our clinical pharmacist provides a total of around 6,000 cases, of which half of them are on infectious disease, and the other 2,500 is on anticoagulation. And also, our clinical pharmacist serves as the core member in various MDT teams, such as the VTE MDT, and we have pulmonary critical care medicine, regional model center, and fibro disease MDT, neuro critical care MDT, and oncology MDT. Also here, I'd like to show you our hospital's laboratory. Our hospital laboratory and the university experimental platform provides strong support for our research. We have TDM laboratories and shared platform in biological diagnostic and treatment center and a research laboratory center which belongs to our hospital. We have several HPLC machine from Waters Elegance, and also we have some LC mass from Elegant. From this one is like 6460. And also at the university public laboratory platform, there's a LC mass from Shimatsu. So you can send samples or do test research to there. And also, if you want to do some further research, we also have the Vascular Drug Institute and Institution for Drug Screening and Analysis. and institute for targeted drug to collaborate with if there's a design for more like in-depth research. So here is the around the number of TDM monitoring uh, increases continues to increase every year in our hospital. Like last year, we carry out like 31 monitoring projects and monitor around 10,000 cases. The antifungal agents that have been monitored include fluconazole, voriconazole, pazoconazole, and isoconazole, and caspofungin. Although the overall number of the TDM has relatively high, but we found out that the number of clinical active drug monitoring for antifungal drug therapy was not as high as we thought it would be. So here I searched latest research on the status of TDM monitoring in China. So you can see on the chart what is similar to what happened at our hospital. The study analyzes like 400 departments from 300 department organizations. In the chart, the numbers are the number of the unit reported from different units, and the different color represents the range of the cases monitored each month. So the blue ones you can see that represents that every month they are monitoring the antimicrobials remains. Most commonly is still vancomycin, but most facilities monitored less than 300 cases per month. So also here is the antifungal situation is the same actually, and the antifungal drugs are monitored in even smaller population, with the most commonly monitored drug being voriconazole. But still, the majority of organizations monitor is also less than 300 per month. So, but still, there's the problems exist is about the high mortality in invasive fungal infections, especially in ICU patients. So this still remains a serious problem. So at the same time, the rising antifungal resistance is also a major concern. So therefore, there is an urgent need for early diagnosis and personalized dosing. To address these challenges, we have during several studies. The studies like we're doing the PKPD modeling using for fluconazole and voriconazole and ishcanalkidins. The second, the in vitro surgery testing using the e-test method for caspofungin combined with azoles against resistance candidate species was performed. And the third one, we conduct clinical against resistant the clinical were doing some respective analysis to evaluate the efficacy and safety of caspofungin monitoring versus combinations. Finally, we're working on some diagnostic innovation using the digital PCR sequencing for early IFI detection in collaboration with the clinical lab. So here we can see the results. First, in the PKPD and dosing optimization studies, we can see that we found that in critically ill patients were switching from one antifungal dose to another. The treatment of PKPD goals is rarely considered based on the published population PK models from the Mimic3 database, which is used to find out that fluconazole and voriconazole at the guideline recommended days can achieve over the 90% target treatment. And then we have during this is also the TDM impact shows that the adverse effect around 20% corresponded to a voriconazole trough concentration of 4 milligram per liter. Also, the KM analysis for over than 4 or less than 4 induced hepatotoxicity, indicating a correct relation with the voriconazole trough concentration and hepatotoxicity. Also, for the simulation shows that the echinocadins weight-based and intermittent dosing improved CFR, especially like for examples for caspofungin used during giving the 2000 milligram and every 48 hours. So caspofungins outperformed minimum micafungin and the abdulafungin against paracelsus. Also, we have during in the in vitro surgery studies, the caspofungin combined with azoles shows the surgery against 73% of the collaborator is including FKS mutants 48 hours. The e-test methods were validated for rapid surgery test. This suggests that caspofungin and plus with the azoles may be a potential salvage therapy for resistance isolates. And also in the empirical and preemptive therapy, the caspofungin monotherapy had an 80% response rate, which was superior to the caspofungin combined with voriconazole. It also had lower adverse event compared to voriconazole. In targeted therapy, caspofungin combined with voriconazole reduced IFI-associated mortality. It's like that 1.8% versus 40% for voriconazole no. And also, however, there was no added benefit of caspofungin with allopsis animals versus monotherapy. We're currently also experimenting with new assays for antifungal diagnosis. In diagnosis innovation study for early IFI detection, the sensitivity of digital PCR for detection of Cryptococcus species and pneumocystis and also other aspergillus species was just from the 100% to down to the 84% respectively, and also the specificity was quite good. It's over than 95% over, so respectively. These test kits can also reduce the time to diagnosis by 50% compared to culture, and also in the for the money in they took just maybe just much less than the NGS we're using on the clinic. We have collected data from 250 patients comparing the sensitivity of routine GGM test and blood culture, and also versus with the TNGS to do the test. It shows out that it has a quite good sensitivity for the diagnosis of this. So the data are still impressive. We are just collecting and writing a manuscript at this moment. So also based on these findings, we have several recommendations. First, adopt a weight-based intermittent ignore cadence dosing in ICU patients. Second, use caspofungin normal therapy for empirical or preemptive candidates. And third, the prioritize the voriconazole TDM to avoid toxicity. And finally, link early detection via like digital PCR to tolerate antifungal regimen. In fact, there are still some barriers to antimicrobial TDM, such as the result of post-previous study, which shows that the delayed feedback of laboratory test reports may be one of the bacteria to clinicians initially to use TDM, and also that the benefits of the TDM on treatment outcome are still somewhere unclear. So, to address these issues, we are also currently just conducting a multi-center clinical study with a prospective design to confirm the extent of benefit of TDM. So the finally is I would like to thank my team and Jeff and Jason's team for their continuous collaboration and hope we can work together on more and better research in the future. Okay, I think it's a little quick, right? So just have a thanks for your attention and have a good appetite. Thank you.
Thank you, Jiao. Excellent talk.